Aloha Kauai, this is your County of Kauai briefing from Monday, January 3rd, 2022. Happy New Year everyone, hope you are all staying safe and dry out there. We are sad to start the new year with another Kauai fatality due to COVID-19. The female resident was in her 70s and had been hospitalized. We offer our deepest condolences to her ohana and loved ones. COVID cases continue rising as the Omicron variant spreads statewide. Our case count on Kauai is spiking. The 7-day case average for the week ending December 31st is 114 cases, by far the highest we've seen. To put this into perspective, our average was just under 50 cases a day a week ago. And Kauai averaged 15 cases a day just 2 weeks ago. We expect case counts to continue rising due to holiday gatherings and travel. Our county incident management team and the Kauai District Health Office are hiring additional staff to respond to the surge, and we are grateful to our National Guard members who are now back on duty supporting our response. For the latest, here is Kauai Deputy District Health Officer Lauren Guest.
Thanks, Mayor. Today, the Kauai District Health Office is reporting 104 new cases of COVID-19. Today's daily case count is likely lower due to reduced testing over the holiday weekend. We currently have 3 active clusters on island, 2 social gatherings, and 1 other occupational setting. There are now 706 active cases on Kauai. Today, the state of Hawaii is officially moving to the 5-day isolation guidelines. As such, we will be assessing all of our current cases who are past day 5 and release all of those who are asymptomatic. This will mean that our active case number will drop significantly tomorrow. As a reminder, only cases whose symptoms have resolved are eligible to be released on day 5. Additionally, they are required to continue to wear their mask when around others for the full 10-day isolation period.
Thanks, Lauren. For more on the surge, we turn to Kauai District Health Officer Dr. Janet Berman for Ask Dr. B. Dr. B, how is your office responding to the surge in cases due to Omicron and other factors?
Thanks, Mayor. As our case count continues to rise rapidly, we're streamlining our work, focusing on the initial case investigation calls and gathering the most essential information. The workload is very heavy, and our calls are not always as prompt as we would like them to be. We expect continued increases in our cases in the coming weeks. If you feel sick, even just a little bit, or if you've been exposed, please get tested and then do the right thing with the results while you wait to hear from us. If you test positive, isolate at home and notify your close contacts. If you've been exposed, get tested and quarantine at home if you're subject to quarantine.
Thanks, Dr. B. Now that the holidays are over, our free testing centers are back open full-time. If you traveled, attended large gatherings, or just want to be sure you weren't exposed, please get a free test at the convention hall, Lihue Pharmacy, or our mobile testing van. A full list of locations and hours is posted at kauai.gov/COVID test. If you have symptoms, call your doctor. Next question. Dr. B, there is a lot of news coverage about CDC's changes to the isolation and quarantine guidelines for positive cases. How does that affect us here on Kauai?
The Hawaii Department of Health is adopting the CDC's new guidelines, effective today. The big changes are, for people who test positive, instead of 10 days, patients who are feeling entirely well, have no symptoms, can be released from isolation after 5 days. Those who have symptoms need to continue isolating for up to 10 days. For close contacts who are exposed to a positive case but haven't tested positive, quarantine is also reduced to 5 days, but more people will be subject to quarantine than under the previous guidelines. Under the new guidelines, in order to be exempt from quarantine if you are a close contact, you must have your booster in addition to your initial vaccines, unless you were vaccinated recently. If you are vaccinated but have not had your booster, or you are not fully vaccinated to begin with, you are now subject to quarantine as a close contact. So please get your booster, both to protect yourself and our community and to avoid needing to quarantine if you are a close contact. Even with these new guidelines, cases who test positive and close contacts need to wear a mask whenever they are around other people for a full 10 days. For details on the new guidelines, visit health.hawaii.gov.
Speaking of boosters, the Food and Drug Administration today approved the Pfizer booster dose for children ages 12 to 15. Dr. B, what happens now?
The next step is for the CDC to review the data and make a recommendation. Appointments won't be available for ages 12 to 15 until that happens. We will update you when the CDC makes its decision. Boosters are already approved for ages 16 and older. Evidence shows that the booster dose of the vaccines provides significant protection from severe illness, hospitalization, and death. We know that the immunity provided by the first doses wanes over time, and a booster dose is especially important for protection from Omicron. If you are 16 or older and got your second dose of Pfizer or Moderna 6 months ago or more, or if you got the Johnson & Johnson vaccine 2 months ago or more, I strongly recommend scheduling your booster now. Without the booster, your risk of infection from Omicron is higher, and you may need to quarantine if you are exposed to a positive case without your booster.
Thanks, Dr. B. If you have any questions for Dr. B, please post them on our County of Kauai Facebook page. Booster doses are widely available now for ages 16 and older at hospitals, pharmacies, and clinics around the island. You can get a booster at Long's, Safeway, Walmart, Costco, Foodland, Lihue Pharmacy, Wilcox, KVMH, Mahilona, Kaiser, and Ho'olalahui. Teens ages 16 or 17 need to go to a location offering the Pfizer booster. For a full list, visit kauai.gov/vaccine. Mobile clinics will be held this weekend, and they are open to everyone ages 5 and older. The free mobile vaccine clinics offer both Pfizer and Moderna and the pediatric dose of Pfizer. Mobile clinics will be open at the Kanu'ikepono Public Charter School and the Kekaha Neighborhood Center this Saturday, January 8th from 9 to 11 a.m. No appointments are needed. Minors must be accompanied by a parent or guardian. If your keiki is not yet vaccinated, pediatric clinics are open this week for ages 5 to 11 at Walmart, Long's, Kukui Grove, Kaiser, and Wilcox. In addition to the mobile clinics, visit kauai.gov/vaccine for details. Free testing is available at the Convention Hall weekdays from 8 to 3:30. Free mobile testing is available in Kekaha on Wednesdays, Kilauea on Thursdays, Kalaheo on Fridays, Hanalei on Saturdays, and Kapa'a on Sundays from 9 to 1 each day, walk-ins only. Drive-up testing is free at Lihue Pharmacy with an appointment by visiting alohaclear.com. For a full list of testing locations, visit kauai.gov/COVID tests. Finally today, a huge congratulations to our state champions, the Kapa'a Warriors football team. You made all of us proud with your big win for the Division II crown. What an exciting way to end the year for all of us. Go Warriors. Happy New Year, everyone.